I'll make my question very brief. Dr. Nguyen, you said, I think it was on February the 7th, that the science had changed and the decision to wear a mask should now be an individual one. I was just wondering if there was a study that had been published that somehow changed the science. And if there was, could you explain that from, last month or the past couple of months?
Thank you very much, Representative Green. It's the combination of several things. It's the science has changed and the circumstances have changed. And specifically, I was describing the difference between beginning of February and where we were at the beginning of December. At the beginning of December, at that time, I very much supported mask mandates. And that's because we just found out about Omicron. It looked like Omicron was coming like a flash flood or a blizzard, and it was going to overwhelm our healthcare system, as it did in many parts of the country, as it was doing at that time in South Africa. In addition, we didn't know back in December that the vaccines that we have will continue to protect us very well, especially against severe illness, when we have a vaccine and a booster. In February, we knew that. And at that point, we'd also seen that the very quick rise in cases was followed by a very quick decline in cases as well. The vaccines provide exceptional protection. In addition, we also had ongoing information about the benefit of one-way masking, meaning that even if others around us are not wearing masks, a KN95, N95, or KF94 mask protects the wearer very well. And that's the reason why I supported in February, removing those same mask mandates that I supported in December, which was always the goal. I think it's important that we say these measures that we put into place really have a time limitation, that they are there for emergencies, but we should be ready to lift them as soon as we are ready when the science and circumstances change.
So did I understand you correctly? You said there was a new study that showed the single mask of just the individual who we're concerned about was enough to protect that individual. Is that what you're saying? Did I understand there was a new study published that gave you that information?
No, rather that it's a combination of the Omicron surge, our understanding of the vaccines still protecting against Omicron, and the ongoing information that we have about the protective effect of one-way masking. So it's the combination of those things that changed between December and February.
So the circumstances changed, the science didn't change.
Well, the science has evolved too, because back in December, we didn't know that the vaccines and boosters would be so protective against severe illness for Omicron. And with that new knowledge, we should then be able to adapt our recommendations. I mean, you're a physician like me, and so I think we always say when science changes for our patients, for example, if there's a new cancer treatment that comes out for our patients, our advice for our patients should change. And that's the same thing that's occurred in this case.
Yeah, I hear people keep saying that, but I haven't heard of a study that's been published. And I get the fact that the circumstances of Omicron and its really absence of bad outcomes and things like that, and the effectiveness of the vaccine. Okay, well, I could be just arguing over semantics, but to me, there's no new study on masks that I've been able to find that show that it changes the protective or non-protective status of the patient. I just wanted to clarify that. Okay, thank you very much.